Hello. Hello. Good morning, everyone. Am I audible?
Yes,
Good
sir.
morning, sir.
Okay, everybody is fine? Yeah, I am asking everybody is fine?
Sir.
Okay, good, very good. Okay.
Yes, sir.
Today what we are going to discuss is that we are going to discuss about the that protein, plasma protein, and how this plasma protein plays role in diagnosis of different diseases. And what I have been informed by Sir Partho is that most of the syllabus have been complete, and only two topics are left. One is the plasma protein and its clinical significance, and another is that one, a lipid profile and disease diagnosis. Fine. So this out of these two topics, today we'll try to finish one, and the next week we'll take one, and in this way we'll be able to finish our whole syllabus of this one, unit 3, right? Okay, the students are joining. Almost 47 has joined. So let us start this one. I will just share my PowerPoint, and if you have any problem, please let me know. Okay. Is my screen is visible to all of you? Is my screen is visible?
No, sir.
Is my screen is visible to all of you?
No, sir.
No, sir.
No, just wait.
No, sir.
Yes, sir. It's visible.
Yes, sir.
Visible. Yeah, network is always problem here, and so we may face the difficulty in the network connectivity, but somehow we'll have to bear it, right? And you don't worry about this PPT. This PPT, no, I will send in this one in the group or in the mail ID of your CR. And you can collect your this presentation from your CR. I will just instruct him to give all of you. Fine. You please respond in between, because if you don't respond,
sir.
then I will think that somehow my connectivity is lost, right? At least yes sir, no sir, fine. Okay, you can see my PowerPoint, right? Right or no?
Yes, sir. It's visible.
You can see my PowerPoint or not? Okay, let's
Yes,
start.
sir.
Okay.
Yes, sir.
That's fine. Okay. Yeah, in between, please. What is the plasma proteins and their clinical significance? And by this time, you know what is plasma, right? Maybe when we're having the class now, the physical class, then once I told you people what is plasma and what is serum. And just to remind you people, let me tell you again, you see blood is composed of that watery component and cellular component, right? And water component that is called the plasma. You know, there is RBC, there is OBC, and there is platelets. Fine. And you even know one term that is serum. And I told you how to collect plasma and how to collect this collection of plasma or serum. This is very much important. Whenever you will be coming to clinics in the third year or fourth year, then most frequently you have to enter this term, the plasma protein or serum protein. So collect plasma, what I told you that first of all, you collect the blood cells, you take it there, and you will not add, not add, you will add, then you will have to add the anticoagulant, right? If you are to collect plasma, then you will have to add the anticoagulant. Then you have to centrifuge the blood sample at 3000 rpm for 10 to 15 minutes. Then you will see one liquid part come out in the centrifuge tube, the above part, that will be plasma, right? And if you are to collect this serum, you no need to do anything. Just you bring the blood sample and you keep it in the refrigerated condition at 4 degrees, or in the room temperature also it will do. Just keep it a little bit inclination, almost 45 minutes to 1 hour. Yellow color is fluid will be just serum. It's fine. Okay. This is all about the plasma and serum. So what we are today is that what are the protein present in plasma and how they play a role in disease diagnosis. What I once I suppose I discussed the acute phase protein, right? When we discuss the acute phase protein, I told the people is that the level of certain protein it increases and decreases, right? And this increased level and decreased level give us some idea about particular clinical condition. But it's not confirmatory diagnosis, but it will definitely aid, it will definitely help in our diagnostic procedures, right? So today, when we'll discuss now, we'll discuss little bit about the what is albumin I talk about. What is actually albumin is, but that is not that much important. Only the clinical part is important. For exams, should be ready that describe the measure plasma proteins having clinical importance. You please, I can even say that write the clinical significance of albumin, right? If somehow exam is conducted and if we are to write some subjective answers, then I may ask you that what write the clinical importance of protein albumin, or I may even tell you name the major plasma protein that plays role in disease diagnosis. Name the major plasma protein that are having the clinical significance. Fine. If you find such type of questions, then will be answer we are going to discuss now. Okay. What is plasma proteins? You know, plasma proteins are the proteins which are found in the blood plasma. And what is blood plasma? The clear protein rich which is left behind when platelet, red cells, white blood cells are removed from the blood. In other words, if we remove this cellular component, blood minus all the cellular component, you will find the plasma. Proteins play important role for different physiological functions, not only in animal body but also in case of human being. And this level of plasma proteins are sometimes evaluated in the laboratory analysis to about the patient's general health. This means all make 7% of the total blood volume. Of course, these levels may even vary sometimes. It's fine. In this slide, what we have learned that there are certain proteins which are present in the plasma, right? I mean blood plasma. The level of this protein, the concentration of this protein, this is around this 7% of the total blood volume. Of course, there may be little bit fluctuation. It may sometimes be 6.5 or it may be sometimes 7.5. Right. And this level of this plasma proteins are evaluated just to have an idea about a patient's health. Fine. Okay. What this slide says that just now I have told that how to this one collect this plasma. First of all, even if it is that human hand is on, no need to worry. It is just to make you people understand. You just from the animals you collect. If you are actively cattle, then you collect this blood from the jugular, then you take it in this test tube, then you centrifuge it, and when you will when you will centrifuge, then this type of layers you will find. First, the uppermost layer, this is the plasma, and this is the Buffy-cut, and then this one. Fine. Okay, this we are not going to see much. You know all this. That's good. These are red blood cells, these white blood cells, and platelets. They will form this Buffy-cut, and this will be the plasma. What we can learn here, you see almost 55%. Out of this 100 ml, 55%. 55% will be this one, plasma, and remaining this 45%, that will be almost cellular component. Fine. Okay. This plasma versus serum, we have just seen what is serum. If we are to collect the serum, you will have to, you don't add any anticoagulant. 45 minutes, then you will find that yellow color fluid that will come out, that will be serum. And if we add anticoagulant and then if we centrifuge, whatever little bit reddish yellowish fluid will come out, that will be the plasma. Right? Plasma is composed of serum, and that means plasma is composed of serum and a clotting factor, and serum is the part of blood which lack the clotting factors. Plasma minus clotting factors is serum. Okay, this thing must have been discussed in the physiology. Okay, what this slide says that there are large numbers of proteins which are involved, which are present in the plasma, and these proteins may be simple protein, it may be conjugated proteins, and all these proteins are not present just like that. They carry out numbers of different functions. Fine. So when some proteins lack in the plasma, then normal function gets hampered, and the person or the animal will suffer. That is the logic. Okay. Protein, if we are asked to name in the exam, they write the different plasma proteins. You can write this albumin, globulin again, alpha globulins, beta globulins, gamma globulin, and fibrinogen. Out of this, the highest concentration, this is the albumin, that's 60%. And then globulin, followed by this globulin, this is 36%, and fibrinogen, this is very less, this is almost just 4%. Right? And you even know that most of the proteins are synthesized in the liver. However, this gamma globulin, gamma globulin, this is the antibiotic. I am not antibody. You know, the antibody, it comes from this lymphatic tissues. It's fine. You see, proteins are synthesized in the liver. Alpha globulin, liver again, globulin again, and gamma globulin. This is the antibody, right? And it is synthesized in the lymphoid tissues. The fibrinogen again in the liver. If we talk about the normal function, albumin, it helps in maintaining the blood osmotic pressure, and alpha globulin transport lipid and fat soluble vitamin, beta globulin transport lipid and fat soluble vitamin, and this is a constitute a type of antibody, and then that fibrinogen, you know that this is responsible for the blood coagulation. Okay, now you see that all these proteins, what we have, just I have mentioned, no, albumin, globulin, fibrinogens, right? And little bit we'll try to know about its biochemistry, and in fact the details is not that much important, only the clinical relevance, in which condition these proteins are decreased, or which condition these proteins are increased, or what the condition that will happen or that will occur due to excess or deficiency of this protein, that you should be aware of, that you should know, right? Okay, if you talk about the albumin, just now we have seen that this is the most abundant protein found in the plasma, and this molecular weight is almost 68 to 69. This is Dalton, right? This is Dalton, right? That unit is, even if it is not written, just you please do remember, this is Dalton, 69,000 Dalton. That means it is 69 kD. kilodalton or kDa. You can write kDa also. Then 69 kDa or 69,000 Dalton. Fine. This is the most abundant protein. Points to be remembered here. The most abundant protein present in the plasma is albumin. Fine. And this molecular weight is 68 to 69 Dalton or 68,000 to 69,000 Dalton or 68 to 69 kilodalton in another word. About 40% of the albumin is present in the plasma and the other 60% is present in the extracellular space. Okay, you can write is fine. But important point to be remember, most abundant protein present in the plasma is albumin. Okay. Then synthesis, it is synthesized in the liver. Rate of synthesis is 40 gram per day, right? And these parts is not that much important, so I like to skip the things which is not important. But whenever I will share the slide, you please go through once for your knowledge. It's fine. You please go through once. It is synthesized, right? From a clinical point of view, what we should know is that what is this protein? Just a little bit introduction. We have come to know that albumin, this is synthesized in the liver. This is the protein which is found in the highest concentration in the plasma, and the molecular weight is 68 to 69 kDa. It's fine. And rate of synthesis is 40 grams per day. This much is fine. And structural albumin, just see people see. Okay, let us see about this function, because why you need to know the function. If the protein is absent, that means this function should be hampered. And if these functions are hampered, then only there will be disease. Then only that animal will suffer. Fine. So you need to have some idea about this function. First of all, it exerts low viscosity. It contributes 70 to 80% of osmotic pressure and plays an important role in the exchange of water between the tissue fluid and the blood. This is important. Contributes 70 to 80% of the osmotic pressure and plays an important role in exchange of water between tissue fluid and the blood. It helps in transport of several substances, namely the free fatty acids, unconjugated bilirubin, calcium, and steroid hormones. It is having this transport function also. First of all, it maintains the osmotic pressure in one word or one sentence, if you have to remember. No need to make it complicated. It maintains the blood osmotic pressure. It is responsible for transport of certain substances like free fatty acids, unconjugated bilirubin, calcium, and steroid hormones. Fine. In addition to this, certain drugs also bind to the albumins, and then it is carried to the target tissue. Certain drugs like the aspirin, penicillin, sulfonamides, they are conjugated with the albumin, and then they are transported to the target tissue. So what we have seen here, three functions. First of all, albumin is responsible for maintaining the osmotic pressure. Albumin is responsible for transport of certain substances. Just one or two examples. Just give this one or two example, which are the substances which are transported by the albumin. Just bilirubin you can remember very easily. Calcium you can remember very easily. Steroid hormone you can remember very easily. And certain drugs. Aspirin you can remember very easily. Penicillin you can remember. Right? These are the drugs which are conjugated to the albumin, and then they are transported to the target tissue. Fine. Okay. This clinical significance. You see something you will have to remember here. There is no other way go to understand. Right? In which condition albumin is decreased, or in which condition albumin is increased. So these things there is not much to understand in fact. Right? You just make some notes parts how you can remember this thing. I can ask that what is albumin, right? The clinical significance of albumin. Fine. You please note down this question. I can happen to be here. Yeah, you can answer that things very easily. The subjectives. Okay, it's fine. Clinical significance. In which condition? Decrease when the concentration of albumin decreases in severe protein calorie malnutrition. PCM, protein calorie malnutrition. Right? Liver diseases like cirrhosis of liver. Why? We know that proteins are synthesized mostly in the liver. If a liver and then generally, then this normal levels will go down. Got it? This is the concept. Liver disease, if liver is infected or liver not infected, liver is not working properly, it is diseased, then it will not be able to synthesize the protein. Fine. And nephrotic syndrome, kidney is not working properly, then what will happen? Then albumin will go out, and then the blood levels of the albumin, it will go down, right? So this is we can see the reduced concentration of albumin in this liver disease, nephrotic syndrome, malnutrition. This is the important word, right? Decrease in albumin concentration also leads to edema formation. This is one of the point to be remembered. Decrease in albumin concentration leads to the edema formation, right? And how this edema is formed, we will learn in detail whenever we will come to clinics. Okay, edema, just for your awareness, just do remember that decrease in albumin concentration leads to edema formation. And edema occurs when the total protein fall below 5 gram percent and albumin level below 2.5 gram percent. Okay. This is all about the clinical significance. This is just see, but this slide is very much important. This is just read it. This also just read it. This also you just read. I like to skip the things. Okay. Now come to the globulin. You see what we have learned. We have learned what is serum. We have even learned how the plasma is separated, how the serum is separated, and we have even learned what the protein present in the plasma. Out of this, what we have discussed about the albumin, in which condition albumin is increased, in which condition albumin is decreased, right? It's fine. So if you are asked write the clinical importance or clinical significance of albumin, you will be able to write. So now come to this globulin. Again, this molecular weight, it's a little bit bigger protein, larger protein than the albumin, right? So you must have learned that, you must have heard word albuminuria, where you will find the albumin in the urine. But you must not have learned our globulinuria or globulinuria, because globulin is so large that it is not easily excreted out of the urine. It's fine. This molecular weight, you see, 90 kDa, 2. How much it will be? 1, 2, 3, 4. Almost 1300 kDa. It's fine. So big protein. So easily it does not come out of the urine. Okay. If you talk about the globulin, you see again alpha 1 globulin, alpha 2 globulin, beta globulin, gamma globulin. You know, you are aware about this gamma globulin. Fine. This is the antibody molecule. Okay. Site of synthesis, again, this is synthesis in the liver. And this gamma globulin, what we have seen that this is lymphoid tissue, right? And this is beta cells of the lymphoid tissue. It is more specifically the beta cell lymphoid tissue. It is synthesized. And you see, synthesis of gamma globulin is increased. You see, when this antibody molecule increase, antibody will be increased when there will be infections, right? So this is not must to be remembered, understood. You see, synthesis of gamma globulin increase in chronic infection, when there will be disease conditions, autoimmune diseases, leukemias, lymphomas, or various other malignancies. These are the conditions where gamma globulin is increased, because gamma globulin means this is the antibody molecules. It's fine. When there will be an infection, definitely that gamma globulin or antibody molecule will be increased. So this you can remember very easily. Okay, again, this you see what we have seen here. We have seen here alpha 1 globulin, alpha 2 globulin, beta globulin, and gamma globulin. And this alpha globulin, again, alpha 1 antitrypsin, alpha 1 acid glycoprotein, alpha 1 fetoprotein, alpha 1 globulin inhibitor. You see, no need to remember all these things in detail. Again, I'm repeating, you no need to remember all these things in detail. So don't get confused. Whatever I say, you need to remember, just to remember that. But do read all these things also for your knowledge. Fine? Please do read all these things also for your knowledge. Okay, this alpha 1 acid glycoprotein, this is called orosomucoid. The point to be remembered here is that orosomucoid is considered to be a reliable indicator of acute inflammation. Please do remember this line. If I ask you in the blank space, you will have to be able to remember, able to reply. Orosomucoid. What is orosomucoid? Orosomucoid is also another word called as alpha 1 acid glycoproteins. So if I ask you in the true and false, alpha 1 acid glycoprotein is a reliable indicator of acute inflammation. So you should be able to reply that. Right? Or if you ask orosomucoid, or I may even ask the alpha 1 acid glycoproteins. Fine? So please do remember this line. And in which condition it increases? Consistently rise in the acute and chronic inflammatory diseases, in cirrhosis of the liver and many malignant conditions. Decrease low concentrations occur in generalized hypoproteinemia, different hepatic conditions where this liver is affected, hepatic disease, that means cachexia, malnutrition, nephrotic syndrome. Fine. This is not that much clinically important. So if you feel like just remembering, just remember it. Otherwise, it's okay. Then come alpha 1 fetoglobulin. It is present in high concentration in the fetal blood during mid-pregnancy. As this name itself suggests, somehow it is related to fetus, right? It is present in the high concentration in the fetal blood during the mid-pregnancy. And in case of normal adult blood has very less. Hello?
The slides are not moving.
Anybody is telling me something? Anybody is telling me something? No, right? Anybody is? Can you hear me, right?
Yes, sir.
Please respond. Then only I will know that at least you are listening what I am saying. Okay, fine. Okay, let's come again. Okay, what we have learned till now, again, let me repeat. We have learned about the importance of albumin in detail that you will have to remember, right? Then we have seen this globulin. Then we have just mentioned one important point, orosomucoid, right? Indicator of the acute inflammation. Then we have come to this alpha 1 fetoglobulin, right? And this is present in high concentration in the fetal blood during the mid-pregnancy. Okay, clinical significance. This is also, again, you should remember the hepatocellular carcinoma. Presence of alpha 1 fetoprotein is full diagnostically in determining the presence of hepatocellular carcinoma. Right, the tumor marker. So you should remember this point also. I may ask in the blank space or true false or this multiple choice. Right? What is the marker for the hepatocellular carcinoma? Understand? Hepatocellular carcinoma. You should be able to remember that alpha 1 fetoprotein. You see, whenever I say no, you please note down this thing. What is important? What I have said till now, write the clinical importance of albumin. Then I have said that orosomucoid, why it is important. Then I have said this line, that hepatocellular carcinoma, right? This is the tumor marker. This is the marker. I mean, the marker of this is the alpha 1 fetoprotein. Alpha 1 fetoprotein is the marker for hepatocellular carcinoma. These 3 or 4 important lines I am telling. So you please note down. Okay, then come this alpha 1 antitrypsin. Molecular weight, okay, it is fine. It is again synthesis in the liver. Exam alpha 1 antitrypsin. Can you remember this thing that this alpha 1 antitrypsin, somehow we have mentioned this word when we discuss this one, acute phase protein. It's fine. Acute phase protein. This is considered to be one of the acute phase reactant, acute phase protein. It's fine. As these are not that much clinically important, so I will just like to skip these things. Right? But you please do read this thing at least once. Fine, I will just skip it. Somebody is still joining. Okay. Alpha 2 globulin, I have skipped this thing because they are not that much important. Right? But you please do read these things for your knowledge. Okay, alpha 2 globulin, heptoglobin, and cytoplasmin. Let's see. Oh, okay. These are also. Okay, alpha 2 globulin, heptoglobin, and cytoplasmin. Let's see. Oh, okay. These are also. Okay, alpha 2 globulin, heptoglobin, and cytoplasmin. Let's see. Oh, okay. These are also. Okay, alpha 2 globulin, heptoglobin, and cytoplasmin. Let's see. Oh, okay. Haptoglobin and ceruloplasmin. Ceruloplasmin is the containing protein, right? Containing ceruloplasmin. Just to remember this slide. Copper containing protein. Just do remember this line. Don't remember that much, right? Okay. If it is increased, the cellular plasmid, this is increased during this pregnancy, in different inflammatory conditions, then this malignancies and oral estrogen therapy. Don't need to remember. Just remember this thing during pregnancy or inflammatory process. And decrease protein is found to be decreased in Wilson disease. You should be able to remember that is the ceruloplasmin. Again, I'm repeating this line. Which protein is found to be decreased in Wilson's disease? Right? So you should be able to reply that that is the ceruloplasmin. Right? Okay. Then come this haptoglobin. This is also not that much important from clinical point of view, so I like to skip this also. Let me skip this thing. Then come another, I just mentioned this. If you can remember, see the active protein. Transferrin, this is iron containing protein. This just remember this point only. This iron containing protein. Others you just read it. Because if I read all these things, you will get confused. And these are much important also. So I'll just like to skip. Whenever I feel that something is important, I will tell you people to remember. And yeah, this point too you should have to remember. Serum transferrin. You should say iron containing protein. Right? Serum transferrin levels are seen increase in iron deficiency anemia. This is iron deficiency anemia. Remember, deficiency anemia. Then this serum transferrin level will increase. Just remember this point. And then come the C-reactive protein. This little bit you'll have to know because this is also one of the important acute phase protein. It is present in concentration of less than 1 milligram per 100 ml in the adult male, and it precipitates with a group C polysaccharide of the pneumococci in the presence of calcium. Hence, it is named as C-reactive protein. Just why it is named as C-reactive proteins? Because it precipitates with the group C polysaccharide. Now, you just see what is group C polysaccharide of the pneumococci. Just Google it after the class and just try to understand what actually it is. Hence the name comes the C-reactive protein. Clinical significance. It can bind heme and bear some chemical and the antigenic relationship to the liver catalase. It can bind it to T lymphocyte and can activate complement. This point is important. C-reactive proteins, it bind with the T lymphocyte and activate the complement pathway. A role in the formation of heme protein or as opsonin. Opsonin also, what I can remember in the class we discussed what is opsonin, right? It is a sensitive, if not specific, indicator of the early phase of inflammatory process. This is also important point to be remembered. It is sensitive. Of course, it is not specific, but it is a sensitive indicator of inflammatory process. It remains increased in the presence of solid tumors, but not in the condition which impair the immune response, such as leukemia or Hodgkin's diseases. And no need to, that you will get confused. No need to remember. Just do remember that C-reactive protein is an non-specific. It is not specific. If I ask you that it is a specific indicator, then it will be a false statement. It is a non-specific. Yeah, of course, it's a sensitive indicator of the inflammatory process. C-reactive protein is a specific indicator of inflammatory process. This is a false statement if you are asking the true or false. But if I ask you that this is a sensitive indicator, yeah, that is a true statement. So this is important. Okay, I suppose this must only hemopexin never. You don't need to this one, just the read ones. Not much clinical significance, not much important. I can read it, but this is of no use. You will simply feel bored, and there is not that much important also. So I like to skip this. Gamma globulin, IgA, IgM, IgD, IgE. You have learned much detail about this antibody structure and all these things in your immunology classes. So I would like to skip these things also, right? Okay then. You see, this much only you should learn. Not much to be learned here. You see what we have learned here. In short, we have most important thing is that what we have learned about the different plasma protein, first of all, and then what we have learned, what the clinical significance of the that will write just make a note of 2.5 mark, and whatever is true and false, what I have said, orosomucoid or this CRP, what I have said, no, just you make all these 4 or 5 lines. That much only important. It's fine. Anything? Can you hear me? Just respond.